All right, we are jumping into the very last chapter of the entire semester. And of course, we're going to finish on a high note, which is genitourinary diseases. So there are a handful of potentially maybe sensitive pictures. I have removed them because I do not want YouTube to take down my account. So hopefully you're in the class, and if you want to see these pictures, that is how you can see them. So if you are watching this and you're like, this seems like it's missing some things, it's because I've removed the pictures that might not be appropriate for a public lecture on a public forum. So this is another set of diseases that we're kind of clumping into um, titling it one system, but technically it's two. So we have the urinary system and then the reproductive system. So we have to break them apart essentially by the organs that are primarily associated with those particular systems. Now, this probably makes sense to you, but these systems do have a tendency to work kind of together, especially in the male reproductive system and urinary system. It's all kind of clumped into one, and you'll see why when I show you some diagrams. But when it comes to the female reproductive system and the urinary system, they don't associate so much like the male reproductive system does. However, for the female reproductive system, everything is very close together. So that's kind of an important thing to make a note of. And that's why so many problems can happen when it comes to female reproductive systems, because everything is very close to a lot of exits. So the urinary tract is going to serve the purpose of basically filtering your blood and regulating like things like your blood pressure, things like that. And that is how urine is formed and then stored in the bladder, and then it exits through the urethra. So the primary players for the urinary tract is the kidneys, those are the filters, ureters, that is going to allow for that waste that the kidneys filter out to filter down to the bladder. The bladder is going to be that kind of holding cell for urine, so that you're not just constantly peeing yourself. Once your bladder is full or you feel like you can pee, then that urine exits through the urethra. That is the exit. For the reproductive system or genital system, however you want to think of it, I think reproductive lets us know exactly what's going on there. We have to talk about a difference between males and females because there is a difference in the anatomy. So for males, the reproductive system consists of the testes, which are going to be external. Epididymis, this is going to produce sperm. The vas deferens, this is going to be the tube that carries sperm through the prostate gland. And then we also have the scrotum and penis. The urethra is also included in the reproductive system. I know it's not listed, but just know that the vas deferens, after it goes through the prostate gland, it then becomes the urethra. Still the same tube, and it kind of acts as like, I don't know, you can kind of think of it almost like an interstate. We are connecting the urethra that is coming from the bladder and then the vas deferens that's coming from the testes into the urethra that will be in the center of the penis. So a lot of stuff is passing through that area, and most of it, very important, is external. There are a handful of things that are internal, like the prostate gland, the bladder, part of the urethra, but a lot of the male reproductive system is external. Very important. For the female reproductive system, we're talking about the uterus, fallopian tubes, ovaries, vagina, and cervix. So all of those areas are going to be internal exclusively. So make sure you know that the male reproductive system is mainly external. The female reproductive system is mainly internal. When it comes to the defense system of these two separate systems, we do need to still talk about them kind of separately here. For the urinary system defenses, very kind of immediately you should think of this. Urine is constantly flushing the entire urinary system. And urine in and of itself is pretty acidic. It also contains a handful of proteins and things like that, and lysosomes that is going to inhibit bacterial growth. Is it a perfect system? No, because we can still get infections in the urinary tract, which can be pretty bad. So we are going to talk about that, but for the most part, this system of removing that waste, that urine, is going to help in making sure that the urinary tract does not become overrun with bacteria. Because remember, we have that urethra, that is that opening at the kind of in the genital area, right? So you have an opening, a portal of entry, right? That can lead to problems, but for the most part, you are constantly, and you can think of it this way, cleaning the pipes by urinating. The reproductive system, it's going to depend on whether we're talking about males versus females. For males, urinating is going to serve the same purpose of kind of cleaning out the reproductive system. So potentially after coitus or having sex, the urethra can become kind of clogged in a way. Not clogged where you can't pass anything through, but there can be a lot of microbes that have made their way into the urethra. Urinating after sex is a great way to flush that system and make sure that any of those microbes don't make their way up any higher past the entrance of the urethra. The female defense, it's going to kind of depend on what point in time a woman is at. So for the most part, the process of having a period is going to, I keep using the word kind of flush or clean out the entire system. So a period is going to be where you have the lining of the uterus, that endometrial lining is going to shed. That shedding of that lining is going to take any microbes with it. So you are flushing the system by shedding that inner lining. However, once you get to a certain point in life, you go through menopause and you don't have any more periods. The other thing that is going to be very helpful during a female's reproductive years is the pH of the vagina. It is relatively acidic. Not as acidic as, say, like stomach acid, but it's a pretty acidic environment. It has everything to do with trying to prevent microbes from growing in the vagina. So keeping those numbers of, say, like yeast, which yeast naturally grows in the vagina. That is a natural occurrence. We just don't want a lot of cells being able to grow in that area because then you get a yeast infection and that's no fun. So that acidic defense is going to prevent microbes from growing out of control. So as I have heard from another instructor, I love this phrasing that the vagina is acidic because she's a bit hateful, and as she should be. So those are the defenses of our genitourinary system. All right, we have the urinary system here. As far as a female urinary system goes, we've got our kidneys sitting up high. Those yellow tubes coming down from the kidneys are going to be the ureters. The ureters are going to meet at a cute little organ called the bladder. And then we also have the uterus just behind the bladder. And if we go a little bit further, we can see the urethra. An interesting thing to make a note of, comparatively to the male reproductive system, the urethra in females is much shorter, which can also lead to a lot more infections and problems when it comes to the urinary system. Now here we can see the male reproductive system, which is also going to go kind of hand in hand with the male urinary system. Excuse me. So we've got, again, the kidneys sitting up higher. I know they're not really labeled there, but those are the kidneys sitting up higher on the upper left. We have the ureters coming down from the kidneys, meeting at, again, the bladder. The bladder's the same thing in both males and females. But then we have that urethra that is going to pass through the prostate gland and then go down the middle center, if you want to think of it that way, of the penis. Now, we are also going to talk about the reproductive system here. So we have, if you want to look at the image on the right, it's a little bit easier to see. You have that kind of, I always think of it as the starting point because that's where sperm is made. You have the testes, that little thing that looks almost like a jellyfish sitting on the top of the testes is going to be the epididymis. This is the actual structure that physically makes the sperm, and as well as kind of stores it too. So from there, you're going to have a little tube that's going to, the blue tube that is, follow its way up and along and around the bladder until we go through the prostate gland. So that is the vas deferens. Once we get to the prostate gland, there's a very short part of the tube going through the prostate called the ejaculatory duct, where it then meets the urethra, same as the bladder, and then exits the penis through that urethra. And again, the urethra is much longer in the male urinary and reproductive system because they have the penis. So, and a lot of those structures are going to be external. Very important to make a note of and to remember. All right, and here is the female reproductive system. Again, separate from the urinary system. They're close together, but they do not work in tandem really like the male reproductive and urinary system. So we do have the uterus. It sits between the colon and the bladder. It is essentially just a muscular organ that when you are on your period, if you have a period, it is contracting to remove that inner lining while you are actively bleeding. So fun stuff about the reproductive system. The entrance to the uterus is called the cervix. The cervix is going to be kind of a gatekeeper, if you want to think of it that way, allowing things in, keeping things out. That is kind of the purpose there. Now, other structures surrounding the uterus is going to be these kind of, they almost look like horns if you look on the image on the right. Those are the fallopian tubes themselves. Attached to the fallopian tubes, kind of looking like pom-poms, are the actual ovaries. So a lot of people kind of mistake this for whatever reason. You guys will never do it again because you're learning it here. An ovary is the actual structure that holds eggs. An ovary is not the egg itself. So kind of keep that in mind. Where we want to see an egg attach and potentially join with a sperm, forming a zygote, is going to be on the inside of that uterus, not in the fallopian tubes. That would be known as an ectopic pregnancy. Anything that is happening outside of the uterus as far as a zygote forming and then attaching to some type of wall is an ectopic pregnancy. The only place we want to see it happening is inside of that uterus, kind of where we see almost a T forming there. Now, if we move further down from the cervix, a little bit more south, we're going to see the vagina. And that is that actual canal that is going to join with the external portions of the female reproductive system. So there are two kind of important skin structures. You probably know them just as the labia, but we do have a labia majora and labia minora, which are just essentially folds of skin that act as protection on the outside, the external portion of the reproductive system. But for the most part, everything's internal as far as females go. The vast majority of everything that is reproductive for males is external. So kind of an interesting difference. And very briefly, talking about the normal microbiota of the urinary system, more than we previously thought, you don't want microbes growing in the upper urinary tract, like in the kidneys and the ureters. There are a few that might exist there. However, as we look at the urethra, we are seeing that there are quite a few established microbiota, but it is a little bit different between males and females. So for males, again, they have that more external system with having a penis, versus females that are much more, have a shorter urethra, and also that means that the entrance to the urinary system is also very close to the vagina, very close to the anus, and has a higher risk of infection than males do. As far as the reproductive system, males, again, kind of the same microbes as you would find in the urinary system. Again, not that many, it's just kind of a normal situation. When it comes to circumcision, this is going to have a decent effect on the normal biota of the penis, where uncircumcised penises result in a larger population of more diverse microbes than a circumcised penis. So it has to do with folds of skin, things like that. For females, it's going to depend on where you are in life, essentially, as far as age goes, before puberty, after menopause. There's a very similar amount and type of microbes in the urethra and the vagina. But in reproductive years, that's going to be very different. So if you want to think from puberty until menopause, things were a little bit different in those regions. So you're going to see more yeast, maybe a lactobacillus type of microbe as well growing in the vagina. It just depends. And again, we are wanting those microbes to be much lower in the system, closer to the entrance. We don't want them to be higher than that, especially not in excessive numbers. Now, we originally thought that the uterus was sterile. However, we are finding that there are very minor numbers of microbes in those areas, and has a lot to do with that human microbiome project. All right, we are going to start with the urinary system diseases. Again, we just want to know those 5 things that I've been telling you all through the last system or unit. So you need to know microbe type, you need to know the reservoir, transmission, as well as the causative agent, and then signs and symptoms that are going to be kind of unique to this particular disease. So make sure that you are keeping track of that. Again, flashcards are a great way to study as far as memorization goes. Naturally, for the urinary system, we are starting with a UTI, or a urinary tract infection. The microbe type for UTIs are typically bacteria, and the most common of the bacteria that can cause a UTI is going to usually be E. coli, but it can also be a handful of others. The one I want you to know, though, is E. coli. That is the most common causative agent. The reservoir is humans. Transmission is usually endogenous. So it's kind of opportunistic microbes that are traveling from the GI tract. We used E. coli as an example many, many, many moons ago, as far as a lecture goes, that E. coli works very well in our digestive system. If it stays in the colon, we're having a good time. It does a lot of important things for us. However, if E. coli moves or travels to the reproductive system or to the urethra, it can cause a lot of issues. So it is kind of opportunistic as far as microbes go, having that it's normally part of our home team, but if it moves to an area it shouldn't be, causes problems. You can also see a difference between that community acquired, so that endogenous infection, versus a healthcare associated infection. And this is usually from the placement of a catheter that is not sterile, or maybe it was not handled properly. Either way, the catheter being inserted into the urethra is not clean, and that can cause a UTI as well. Prevention is just good hygiene practices, limit catheter usage. I feel like we should all be doing that in general. Avoid it if you can. Some prevention, things that make you pee is what I'm going to say. Things that encourage your body to urinate more is usually going to be very helpful in the prevention of a UTI. However, once you have a UTI, something like cranberry juice is not going to actually help. And also, most people don't drink true cranberry juice. They drink like cranberry cocktail juice, and that's mainly just sugar. If you drink genuine cranberry juice, like, it is tart, right? It is not that pleasant of a beverage. If you like it, I'm sorry, I don't mean to yuck your yum. But once you have a UTI, cranberry juice is not a treatment, but it can prevent a UTI because it makes you pee a lot. It's a diuretic. Treatment is going to be antibiotics, but some of these microbes that we've seen cause UTIs are becoming antibiotic resistant. But again, back to that cranberry juice, it is not a treatment for UTIs. It's a decent preventative measure because it makes you pee. Now, UTIs are typically classified as bacteria getting into the urethra. However, that bacteria can go up higher, like into the bladder, maybe the prostate, maybe the ureters, possibly up to the kidneys, which is not a good thing. We do not want that to go up higher, but UTIs can be higher than the urethra and cause a lot of problems. Some signs and symptoms that we might see is pain, maybe frequent urges to urinate, pain when urinating due to the inflammation of the urethra, maybe cloudy urine because there's bacteria and white blood cells in the urine. The thing we want to look out for is possibly orange or red tinted urine. This means that there are broken blood vessels somewhere in the urinary tract, and that is not a good thing. Maybe we'll see a low-grade fever, possibly nausea, possibly back pain. Has to do with inflammation, pushing on nerves. Maybe it's the kidneys causing that back pain, if the infection goes up particularly high in the urinary system. All right, next up is leptospirosis. The microbe type is a bacteria, and specifically one I don't think we've talked about yet, But we mentioned this very early in the semester, but this is a spirochete bacteria. It's a little kind of corkscrew. You can see an image of it up there in the top right. But these guys are going to uh, come from the urine of rodents, typically, is where they hang out. The causative agent that likes to exist in rodent urine is Leptospira interrogans. Um, what we see as far as transmission goes is usually contact of the skin, abrasions, or mucous membranes with this infected urine from, again, usually rodents, or possibly vehicle transmission on an environmental surface that has been infected with that urine. Now, the thing that I kind of want to get across here is if you have mice or rats in your house, um, you probably want to get rid of anything that they have urinated on. And I know that can maybe be hard to kind of tell, but usually urinating and defecating. So if you see little rat duties around, they probably have also urinated on those areas, cleaning any items as good as you can. But if that urine has soaked in so deeply, it is best just to get rid of that product. So something that you might see on something like the show Hoarders, they will not let the individual that is the focus of the show keep anything that has clearly been ransacked or peed on by rodents, and it is because of this concern of leptospirosis. So prevention is just not interacting with rat urine, essentially, or mouse urine. Treatment, in the early treatment, we try to treat with antibiotics, but later stages, it is much harder to treat. All right, so leptospirosis actually has quite a few different strains, and it can also travel through the blood, which means that there are quite a few symptoms possible, and it can be a little bit hard to diagnose. However, let's talk about early phases and then the second phase. So the early or leptospiremic phase is where the pathogen appears in the blood and possibly the cerebral spinal fluid. It's going to cause sudden high fevers, chills, headache, muscle aches, conjunctivitis, possibly vomiting. So we do want to try to treat leptospirosis during this early stage. However, if you get into that second phase, the blood infection will be cleared by natural defenses. You might have a mild fever, headache may happen, as well as meningitis is possible. So in this second phase, this is where it moves from the blood to other organs. We can see the kidneys being affected, the liver being affected. We might see some jaundice, maybe anemia, neurological disturbances. Again, that's going to be that meningitis, which can lead to long-term disability, possibly death. So the second phase is a little harder to treat, but it is very important to treat leptospirosis early if caught early enough, because once these problems set in here at the end, whatever essentially like whatever damage is done, we can't reverse that. You know, we can try to fix it, but once that problem is done, it's done. We are going to move on to the reproductive system. So, as one of my favorite people in the world says, which is Bob Ross, let's have some fun. This is going to be a very interesting end of this unit, I think. And maybe you'll learn some stuff. Maybe there's a lot of stuff you knew but didn't know you knew. And that's kind of fun to find out too. So let's dive in to diseases of the reproductive system. According to the CDC, some interesting information to start us off. We are seeing kind of a difference of various STIs. So STIs are sexually transmitted infections. We can see the numbers kind of changing. We're seeing a decrease in chlamydia, a decrease in gonorrhea, which is kind of neat, but we are seeing an increase in syphilis, oddly enough. A 61% increase since 2019, and this was reported in 2023. So kind of an interesting thing. Unfortunately, we are seeing an increase in syphilis among newborns, and this likely has a lot to do with how the symptoms of syphilis present. So, without further ado, let's jump into some of these STIs. All right, starting with gonorrhea. Would you look at it? That is what it actually looks like, which is kind of terrifying. That is a bacteria caused by Neisseria gonorrhoeae. The reservoir is in humans. Transmission is through any sexual contact. The prevention is going to be safe sex practices like condoms. Properly using condoms is going to be the best defense. So, kind of keep that in mind. Some of the complications that we can see, and it's going to depend on sometimes males versus females. So complications leading to infertility or sterility, that's in guys and gals. So if left untreated, gonorrhea can make it to where you cannot reproduce. It can also spread to the bloodstream, get to the heart or the brain. This can become fatal. It's rare, but it has happened. So it is important to treat gonorrhea if you suspect you might have contracted it. It is just antibiotics. If it is not treated, for females, what we can see is pelvic inflammatory disease. So this is specifically only in females that will happen. And it has a lot to do with the internal organs as opposed to males having mostly external reproductive organs. Now, when it comes to gonorrhea, you may have heard it called a different name than gonorrhea. The common name is the clap. However, we are seeing certain strains of gonorrhea become resistant to antibiotics, and this is what we call the super clap. So it is that antibiotic resistant gonorrhea. Symptoms are usually going to vary through our STIs and STDs here based on males versus females. Has everything to do with where the bits are. So we are going to be seeing in men burning during urination, possibly a thick yellowish or greenish discharge or drip from the tip of the penis. Females will also have a thick yellowish or greenish discharge, usually from the cervix. For most of these reproductive diseases, there are discharges associated with them. So some type of product being produced from the reproductive organs due to the infection. So I do want you to know the features of the discharge for each disease that has a discharge. It is important to note that when it comes to gonorrhea, many females are asymptomatic. Most males will show symptoms, and they can occur maybe 2 to 8 days after the infection. And even if these individuals are not showing symptoms, if they're asymptomatic, they can still spread this bacteria. So they still have it, they're just not showing any symptoms. It is still something that can be spread. All right, so again, know the discharge specifically of gonorrhea, and we can also see gonorrhea in the mouth. It can affect mucous membranes. So we can see some pus being produced and inflammation at the back of the throat if the mouth becomes infected with gonorrhea. Moving on to chlamydia. This is another bacteria called chlamydia trachomatis. This is the causative agent. The reservoir is humans. Transmission is any sexual contact. Prevention, also safe sex practices, condoms, because it can cause complications, much like gonorrhea. If left unchecked or untreated, it can result in infertility or sterility in guys and gals. In females, much like gonorrhea, it can also cause pelvic inflammatory disease. So again, this is only in females, that PID. The treatment is going to be antibiotics, which is kind of nice because, as scary as a lot of STDs sound, these are very treatable things. So it is a bacteria. We can treat it with antibiotics. Now, the thing I want to get across here is it can grow on pretty much any mucous membrane. This includes the mouth. It can even include the eyes. So that is an important thing to kind of keep in your mind, that chlamydia can spread from the genitals to other places like the mouth and eyes. Some signs and symptoms for males and females. We are seeing burning with urination, possibly a runny whitish discharge from the urethra. However, females do have a tendency to have a handful of symptoms like abnormal discharge. It might not be that runny or whitish discharge. Irregular bleeding. However, a lot of the symptoms that females experience can look like other conditions, and this can sometimes go misdiagnosed, essentially, for a little bit longer. And again, if left unchecked, the concern is that females can develop that PID, that pelvic inflammatory disease, or it can lead to infertility or sterility. Now, a lot of males do not show symptoms. About 25 to 40% do not. Now, for females, that's even higher. It can be up to 80% of females who have contracted chlamydia don't show symptoms. And again, that kind of goes hand in hand with that misdiagnosis, because shoot, if left unchecked, you might not be able to have children later, or you can get that pelvic inflammatory disease. So this is kind of one of the reasons why chlamydia is known as a silent disease, because most people don't show symptoms. Very interesting as far as a disease goes. But again, there's a lot of difference here between males and females. Has everything to do with external bits versus internal bits. Okay, so we can see a couple images here. I believe the bottom left is a cervix, and then we see chlamydia of the eyes. We can also see chlamydia infecting the throat. I did remove the images of chlamydia affecting the genitals, but if you feel like looking at that at some point in time in your life, hey, you have free will and potentially access to Google. There you go. Or come to class. Good times. I'll show you the images in class. All right. This might be something that you've never heard of, and that's okay. We're here to learn. This is a STD known as ImGen, which is just kind of a shortened version of the causative agent, which is a bacteria, Mycoplasma genitalium. The reservoir is humans. It is a relatively newly discovered STD. It was discovered in 1981. We're still learning quite a bit about it. The transmission is vaginal and anal sex, possibly oral. Again, kind of unclear. Prevention, good, safe sex practices, condoms. A lot of the complications and issues that can happen if it is untreated is still the same as chlamydia and gonorrhea, infertility and sterility in guys and gals. And then in females, potentially if it's untreated, pelvic inflammatory disease. Treatment, because it's a bacteria, is going to be antibiotics. There are a ton of signs and symptoms, and it has everything to do with males versus females, essentially where your bits are, so external versus internal. We do see a difference in the discharge between males and females as a sign and symptom. So for men, it's usually a white, yellow, or green discharge from the penis. It could be watery, it could be thick, could be foamy. Mainly for females, we see a thin, watery, or frothy vaginal discharge. For both, we see painful urination, maybe pain during sex. For males, pain in the testes, penis, or groin, swelling of the scrotum, maybe anal pain or discharge if anal sex was involved, and that is where the infection is. For females, kind of the same thing, possibly anal pain if that was the type of sex that was the transmission. Now, what's interesting is that more females do show symptoms, but more often than not, they don't. So 55% of women do not show symptoms. For males, 90% do not show symptoms, but you can still infect other people even if you have this infection. We keep talking about this possibility of getting pelvic inflammatory disease, or PID. And again, make sure you know this, maybe write it at the top of your notes. This only occurs in females. So if you don't have a uterus, it's not going to happen for you. This is the concern when it comes to having a uterus. If you have gonorrhea or ImGen or chlamydia, it goes unchecked, you develop this pelvic inflammatory disease, what it can cause is the inflammation of the fallopian tubes, possibly other parts of the upper reproductive tract, and the end result is usually scar tissue forming on the fallopian tubes. The problem that this can cause is sterility or ectopic pregnancies. So an ectopic pregnancy is going to be where a zygote, so the combination of a sperm and an egg, start to develop in an area that they should not. So the kind of sweet spot for a zygote to attach and start to grow and form is in that area of the uterus, that center area of the uterus. If a pregnancy starts to form in the fallopian tube, it is not viable. Unfortunately, that means that pregnancy will need to be aborted because there is no saving that fetus. And in the end, it absolutely puts the mother at risk. So that is the concern of pelvic inflammatory disease, which is a result from all these other conditions like chlamydia, gonorrhea, ImGen, if they go untreated. So in females, this is a big issue. This is a big concern, especially for people who are wanting to have offspring, who want to have babies later in life. Okay, so here we have some nice imagery of the uterus and where we would see an ectopic pregnancy. So the fun fact, the egg is going to pop out of the ovary and then get kind of sucked into the fallopian tube from those fimbriae or fimbria, however you say it. I say it that way. You can say it however you want. And then from the fallopian tube, that egg will fall down into that center area of the uterus. That is where it may start to form that zygote. The sperm will meet the egg in the fallopian tube, but they should fall down together into the uterus itself and start to form that pregnancy. If, however, you have a situation where there is some type of scarring occurring, this can inhibit that zygote from attaching and starting to grow into an embryo, into a fetus, in the uterus. it starts to form in the fallopian tube. And again, that is not going to result in a viable fetus. That will need to be removed for the safety of the mother entirely, because that is not a good place for the fetus to grow. All right, we have two infections that are going to affect females here. We have vaginitis and vaginosis. I have heard people kind of mislabel these before. They call them the same thing that they're kind of not. And it has to do with their symptoms. So let's talk about them. The microbe type that can cause either one of these is going to vary. It could be a fungus like Candida albicans. It could be a bacteria like Gardnerella, or it could be like a protozoan like Trichomonas vaginalis. It just depends. The microbe is going to vary, but those are the three primary ones I want you to know. The reservoir is humans. Transmission is usually opportunistic for that yeast, Candida albicans. It could be sexually transmitted for the protozoan, the Trichomonas, and both opportunistic or sexually transmitted could be the case for bacteria. For prevention, there's really nothing you can do for opportunistic infections, but wearing a condom, safe sex practices is a way to prevent those STIs. So treatment is antimicrobials for those specific microbes. So antifungal, antibacterial, antiprotozoan, just depending on which microbe is causing the problems. Now, there are a handful of signs and symptoms. I do want you to know the difference between vaginitis and vaginosis. Vaginitis, you will have inflammation of the vagina. Vaginosis will not have inflammation. Both, however, can have discharge, and depending on the microbe type, it's going to change what type of discharge we see. So, for the yeast, it is usually a white curd-like discharge. You can think of cottage cheese, and I'm sorry if that ruins it for you forever. For the bacteria, Gardnerella, say that 5 times fast. It's usually not a heavy discharge, but usually a pretty strong smell that may be described more as like a fishy kind of smell. And then for the protozoan, we see a discharge that may be greenish in color. And that is going to be the same for vaginitis and vaginosis. It's just the difference is inflammation of the vagina. So make sure you know that. So we focused on the gals, let's focus on the guys. So a male-specific reproductive infection is going to be prostatitis. This is a bacterial infection of the prostate. Usually it's an endogenous infection from the GI tract, but sometimes you see this happen and there's no microbes causing the problems. It's just an inflammation of the prostate. There is no prevention. However, treatment, if it is a bacteria, is going to be antibiotics and possibly muscle relaxers for the symptoms, and you'll see why here in a second. If the prostate becomes inflamed, that means that the tubes passing through the prostate, the ejaculatory duct from the reproductive tract, and the urethra will be pinched off, essentially, because the gland surrounding it is swollen. So that means that there can be pain in urinating, maybe pain in ejaculating, possibly blood in the urine. It just kind of depends. Because of that swollen prostate, it can also lead to back pain and pain in the groin. And it's because it's putting pressure on the nerves. So honestly, a very uncomfortable infection or situation, just depending on if it's microbe caused or if it just happens. But yeah, so there's prostatitis. Moving on to trichomoniasis, also sometimes just called trick or trick drip. I hate that one, so I might just call it trick because, there we go. Fantastic. This is going to be caused by the protozoan Trichomonas vaginalis. The reservoir is humans. Transmission is direct contact via sex. Prevention is going to be safe sex practices with condoms. Treatment, well, it's one of the most common STIs, and we can treat it actually with just normal medicine. However, I will say that trick is going to be mostly asymptomatic, so it can be hard to diagnose. Now, I said before, mostly asymptomatic. I'm serious. Most people don't show signs of trick. So if they do, for males and females, it's usually itching or irritation of the genitals, maybe burning or redness or soreness, burning when urinating or ejaculating, discomfort during urination. It just depends. There is a discharge for males, however, most don't show that symptom. For females, there could be a vaginal discharge that's maybe clear or white or yellowish, maybe greenish with a odor that's kind of fishy. When it comes to females who are pregnant, it may cause a preterm delivery, so having the baby a little bit too early. Moving on to syphilis. This is going to be caused by the bacteria Treponema pallidum. It is also a spirochete, so it's got that little corkscrew shape. The reservoir is humans. The transmission is going to be through intercourse, but only if sores are present. Very specific. Syphilis does come in stages. So we are going to talk about those different stages and where we would see those sores. So unless there are actively sores, you cannot pass syphilis on, even if you are suffering from it. Prevention is going to be safe sex practices, condoms. Treatment can be antibiotics. And honestly, we can treat syphilis at any stage, but you want to treat it early on, because if you get to stage 3, that is going to cause damage that can't be undone. Even if we treat the syphilis, it's not going to take away something like becoming blind, which is a side effect of syphilis. So let's talk about these different stages. So the first stage of syphilis is going to cause a sore called a canker. It's usually at the site of the infection. It can last 1 to 5 weeks. And what will happen is that sore will heal without any treatment. The problem is that the person still has syphilis. It just means that the microbe is traveling away from that site of infection. And that leads us into stage 2, which is going to be an outbreak of one or possibly whole body rashes. This is going to last 2 to 6 weeks. It may be accompanied by a fever, maybe swollen glands, sore throat, patchy hair loss because it affects the follicles. It damages your follicles, causes your hair to fall out. Headaches, maybe weight loss, muscle aches. This stage will also go away without treatment, but the individual will still have syphilis. Once again, this means that the microbe is traveling, and this time it's moving much deeper, which is very scary if we get into stage 3 without any treatment. There are rarely any outer symptoms, but this is where the microbe is going to start attacking the nervous system and internal organs, like maybe your heart. But we do see eventually, maybe after years or persisting for years, things like paralysis, could be blindness. If it moves into the brain, insanity. It can also cause tumors. So this is going to be the stage of syphilis that we can't undo that damage if it gets to that point. So you want to catch it in that first or second stage. Once we get to that third one and there is that nerve damage, there's nothing we can do, or damage to the heart, there's nothing we can do. I do have some images of stage 1. They're a little bit gnarly. I took them out, but for stage 2, I did want to show you these potential rashes that we can see either in small areas of the body, or they can be all over. If left untreated, there are a lot of complications of syphilis. For pregnant women, it could cause a stillbirth of her baby, or possibly the birth of a baby that dies very soon after birth. Very unfortunate. We can also see, again, those various conditions of like blindness, insanity. Allegedly, Al Capone, who was a famous mobster, suffered from syphilis while in prison, and it caused him to go insane, essentially. But yeah, a lot of complications can happen if syphilis goes untreated, especially if you have a pregnant individual that can be passed from parent to offspring. Next up is a chancroid. This is going to be caused by the bacteria Haemophilus durseri. The reservoir is humans. Transmission is direct contact through sexual contact, essentially actively touching these sores. It's usually associated with sex workers, possibly areas where there's a little bit more poor hygiene, tropical areas, subtropical areas, but it is becoming more common in the US. We do see males who are uncircumcised more commonly infected than circumcised males by this particular bacteria. Prevention is going to be condoms. Treatment is going to be antibiotics because it is a bacteria. Now, I did remove the images. My apologies. If you want to look it up on your own time. The symptoms is that these chancroids will begin as a soft papule or a bump at that point of contact, usually somewhere around the genitals. It will develop into a soft canker, which for males, it's been described as very painful. For females, most don't even notice it. If they notice it, it's usually described as not being that bad. It can also cause the lymph nodes to swell and become tender. In more severe cases, we can also see that those lymph nodes end up bursting, which cause a secondary infection or could potentially lead to a secondary infection. Naturally, that moves us into HPV or genital warts. The microbe type here is going to be a little different than what we've talked about in the past. This is a virus. It is the human papilloma virus, or HPV. There are about 100 different strains of wart viruses. When it comes to genital warts, there's only 4. So, maybe that's a good thing or not. Who knows? Whatever. There's only 4 that cause genital warts. The reservoir is humans. It's direct or indirect contact with a wart. Prevention is going to be, there's a vaccine available for some strains. Otherwise, it's going to be condoms, avoiding contact with the wart itself because it's going to contain that virus. Treatment can come in the form of all the ways that we talked about various wart treatments before. Maybe freezing off, surgery. You can use acid. Don't do it at home, obviously, but this is in a medical setting. Maybe laser or burning. Just kind of depends. Some signs and symptoms that we might see are these warts forming on the genitals or other points of contact. It doesn't just have to be the genitals that this type of wart will grow on. It can also be in or around the mouth, depending. So it's just wherever has come in contact with a wart, we will also see that transmission occur, and then where that contact was, a wart can develop. Now, the problem with genital warts is that it can lead to cancer. That is kind of the big concern here, especially with HPV. There is a vaccine that can prevent the transmission of the virus that causes HPV. So there are preventative measures, but these complications are very concerning. It can cause cervical cancer, anal cancer, oropharyngeal cancer, penile cancer, vaginal cancer, and vulvar cancer. More than 90% of sexually active men and 80% of sexually active women will be infected with HPV in their lifetime. So it's a very transmissible disease, and one to really kind of keep in mind because it can lead to worse things. That's kind of the important thing here. Next up, we have another virus. It is molluscum contagiosum. It is caused by the virus Poxviridae. The reservoir is humans. The transmission is through direct sexual contact or autoinoculation, and indirect contact through fomites, those objects that could have the virus on it, like a towel or maybe clothing. Prevention is going to be avoiding contact with those fomites, and if you're having sex, condoms, safe sex practices. So the treatment is essentially not a whole lot because it is a virus, but the warts that are produced can be removed. The signs and symptoms that we see with molluscum contagiosum is going to be skin lesions that are kind of wart-like, but they can also grow on mucous membranes or the skin of the genitals. Moving into a virus I know you have heard about, and that is herpes. This is caused by the herpes simplex virus type 1 or HSV1 or type 2 HSV2. The reservoir is humans, and there are many individuals who are infected each year with herpes. It is a relatively common STD. The transmission is just direct contact through sex. Prevention is going to be safe sex practices and avoiding contact with an open sore from herpes. The treatment is that there is no cure, but there is medication available that decreases the frequency of outbreaks of herpes. Now, let's talk about that for a second. Herpes is a type of virus that will go and hide in the nervous system if you are not actively displaying sores. That is a symptom of herpes. It goes and hides in the nervous system. From there, essentially, you don't see any signs that you have herpes. So herpes goes into a latent phase. Now, that doesn't mean that when it is latent, you can't spread herpes. That's kind of a misinformation for whatever reason, or maybe people just don't care. But even if you're in that latent phase and not showing any symptoms of herpes, you can still pass it on. It can still move from person to person. Some signs and symptoms to look for with herpes is small red bumps. Could be on the buttocks, the thighs, fingers, vagina, anus, or possibly on or inside the penis. They can be particularly painful. They can occur 2 to 10 days after the infection or possibly years later. It's really just dependent on the person and the situation. The first outbreak of herpes is usually the most severe and the most painful and can last maybe 2 to 3 weeks. There are many symptoms, or I'm sorry, not symptoms, triggers that can cause the symptoms of herpes, that can cause these sores to form. So again, it's going to be that latent phase where you're not seeing any symptoms, and then suddenly something happens and you have an outbreak. So it could be illness, stress, too much sunlight, maybe like a sunburn, fatigue, menstruation, anything that weakens your immune system or your body that can cause those sores, that outbreak to happen when you have herpes. Now, something I want to talk about too is that mouth herpes is also a thing, as well as anal herpes. Now, when it comes to anal herpes, the appearance of it has a tendency to look more like genital warts, and that has to do with scarring from friction. So, as you walk, skin rubs together, and if you have a sore caused from herpes in those areas, it's going to keep kind of breaking open. I can only imagine it's incredibly painful. And because of that scarring, that herpes that is formed around the anus can look more like genital warts than it does look like herpes. Okay, that moves us into neonatal group B, Streptococcus colonization. This is specifically an infection of neonates, so the really small babies. The microbe type is bacteria. It is the group B, Streptococcus, or GBS is sometimes what it is called. The reservoir is humans. Transmission is vertical transmission from mother to the infant during the birthing process. Prevention is usually that all pregnant individuals are screened for this GBS bacteria so that they can be treated prior to giving birth. The treatment is antibiotics. However, we are starting to see some antibiotic resistant strains. Now, when it comes to the signs and symptoms, the best case scenario is a preterm delivery. So having a baby sooner than expected. Worst case scenario is potentially life-threatening infections of the bloodstream of the neonate, meningitis, maybe pneumonia, which all can lead to potentially death of that baby. So mothers can get amniotic infections, which can cause stillbirths. So there are a lot of concerns when it comes to GBS. So getting that screening prior and early is going to be the best case scenario as far as prevention of causing problems in neonates. All right, for your viewing pleasure, not technically a microbe, but something that is pretty common when it comes to the genitals, and that is pubic lice, sometimes called crabs. So again, this is not a true microbe, it is a tiny insect. That is the causative agent. I think it's Phythypurus. The reservoir is humans. Transmission is usually direct contact via sex, but it can also be spread through indirect contact of surfaces because they are just little insects just living their life. So think like pillows or furniture or bedding. These little guys can live there and then make their way to pubic areas or other areas that have hair. The prevention is to avoid contact. Condoms, good hygiene is kind of the big thing here. Being vigilant is also something I'm going to throw in there. Being vigilant and looking for signs of lice is very important. Treatment is an insecticide that is a medication, and then just good hygiene. So things to look for when it comes to pubic lice is itching, especially at night, maybe a rash or a small red or blue spots, which are the bite marks that these little jerks end up leaving. Something else to look for is the droppings of the lice, which look like a black or brown powder. You might find this on the skin, maybe find it in the underwear. It just kind of depends. You may see visible lice, the adults moving around. You could also potentially see their eggs attached to hair. But essentially, we're going to be looking at irritation and inflammation of the genitals, as well as possibly also swollen inguinal or lymph nodes. So those are some things to look for when it comes to pubic lice. Another kind of not microbe, but it is an insect, is mites called scabies. This is caused by the mite species Sarcoptes scabii. Sure, we'll go with that. The reservoir is humans. The transmission is direct contact, that is skin to skin. Prevention is good hygiene, and not sharing personal items like underpants is probably a good move. Treatment is going to be another insecticide and better hygiene. Now, the big difference between lice and mites is that lice will stay external. Yes, they do bite and cause issues on the surface of the skin. When it comes to these mites that cause scabies, is they burrow, and that is terrifying. If that doesn't scare you to death with this, I mean, honestly, absolutely horrifying. And these are some mild pictures, to put it at best. So naturally, these guys are going to cause intense itching. Again, at night, that's when these guys become really active, just like the lice. They cause rashes, something kind of like pimples forming, which, great. The thing that's kind of terrifying is they form almost like these tunnels underneath your skin in certain areas, like your hands and your feet. And so these tunnels, you can basically see where they have burrowed and formed their little tunnel, which is just terrifying. So yeah, that is lice and scabies. I would know them, fear them, know them more than anything. Know what to look for. All right, we are ending on HIV and AIDS. This is a virus. The virus is the human immunodeficiency virus, or HIV, which can lead to AIDS, which is the acquired immunodeficiency syndrome. So make sure you know that HIV can lead eventually to AIDS. The reservoir is humans. Kind of something a little bit interesting is that it was a virus that transitioned from monkeys to chimpanzees, which then transitioned to humans in the 1930s. When it was in monkeys and chimpanzees, it was known as the simian immunodeficiency virus. The current strain cannot jump back and forth, however, between species, and the earliest documented case of a human dying from this virus is 1959. So the transmission of HIV is through the sharing of fluids. Sounds kind of weird, let me explain, but that could be blood, it could be vaginal fluids, it could be semen, possibly through breast milk. So we can see the transmission happen in a variety of ways, but it always is going to be a fluid that is coming from essentially like a deeper tissue. So HIV cannot be passed from contact with someone like touching their hand or giving them a hug or through kissing, unless that person has a particularly intensely bleeding sore in their mouth, and they also have HIV, then you cannot pass HIV through spit. But it can be passed in a handful of other ways. Now, there is a particularly big misconception that this is a homosexual disease. And while in the US, it is mostly contracted through homosexual contact, that is not the only way that it is contracted. Heterosexual individuals pass HIV just as easily as individuals who are homosexual. So the idea that this is a quote unquote gay disease is stemmed from fear and bigotry, is what I'm saying here. So please keep that in mind. It doesn't really matter what your sexual orientation is. You are still just as susceptible to getting HIV as anybody else. There are a handful of stages when it comes to HIV turning into AIDS. So let's talk about them and kind of what those signs and symptoms look like. So first and foremost, the virus is going to infect and purposefully kill your immune cells, specifically known as T helpers. These are messenger cells that kind of act as an alert system in your immune system. So if they take those guys out, there's no way for your body to really like recognize a pathogen. And so the fear essentially with HIV and AIDS is getting any infection at all, even one that might be kind of like a lower risk infection, then becomes life-threatening. So in stage A, usually individuals are asymptomatic or they have persistent swollen lymph nodes. This is still the case where the individual has HIV. In stage B, individuals become symptomatic, early indications of their immune system failing. This is usually when we start to realize that there is something wrong. So maybe yeast infections, persistent diarrhea, maybe shingles. Moving from stage B to stage C, this is where HIV becomes AIDS. So stage C, this is where AIDS indicator conditions are met, has to do with these CD4 or T helper cells falling underneath a certain level that is essentially safe in our body. So you essentially have no immune system is what happens. So it's constant infections, and you are incredibly susceptible to minor infections as well. You are now completely immunocompromised, and the smallest thing becomes life-threatening. That is kind of the scary part about HIV and AIDS. All right, so some prevention is going to be safe sex practices, using condoms, maybe safe, this sounds weird, drug practices, using sterile needles. There is a vaccine in development. However, I don't think it is past the point of being used on people. I think it's still in a lot of testing stages. There is no treatment per se as far as a cure goes, but there is a lot of studies, a lot of medicine that you can take, whether you have HIV or AIDS, or you are in a relationship with somebody who has HIV or AIDS. There are many medicines to prevent contracting HIV. There is PrEP that can be used to make it to where you are less susceptible to contracting HIV. And there are others that reduce the risk of spreading the virus if you do have it, known as ART. So just kind of keep in mind that HIV and AIDS is no longer a death sentence. Is it a concern? Absolutely. Should it be monitored? Yes. But it is not a death sentence anymore. So there is a ton of hope, a ton of research going into the prevention and treatment of HIV and AIDS. And with that, guys, that is the end of this unit. That is also technically the end of the semester. I hope you have enjoyed this last chapter. I think it was kind of a fun one, in my opinion. Maybe you learned some stuff. Maybe you knew a lot of stuff. Either way, make sure to study. This is going to conclude chapter 21. There will be an exam over the last 3 chapters, so make sure you are studying. That is the most important thing to do. So if you have any questions at all, any questions, comments, concerns, please let me know. You know I am available for you. And happy studying. Make good choices.